Hi, my name is Linet. I am the mother of a child with an NTRK fusion positive cancer, and today I'll be talking a bit about what our journey to diagnosis was like, what types of testing was involved, and what the experience feels like as a parent. Finding out that your child has cancer, it completely turns your world upside down. In our case, we found out our son had cancer when he was just 3 months old, and it was something we could have never expected or prepared for at all. It was really important for us to figure out if our child's cancer had the NTRK fusion, because our doctors told us early on when we were discussing, different types of potential diagnoses, that if it was a cancer with this type of NTRK fusion, then there is a targeted therapy that's available that is highly effective and also helps avoid more traditional treatments like chemotherapy. NTRK genes play a normal role in development, but sometimes they can behave abnormally. And when this happens, it causes cancer to grow and develop. NTRK fusions are rare, but they are found in certain types of cancers like infantile fibrosarcoma, certain brain tumors, as well as certain thyroid cancers. On the journey to diagnosis, you'll likely have a lot of different types of testing, from imaging testing to also things like a biopsy. There's different types of pathology testing that can help identify if the tumor has the NTRK fusion. Some testing, like the genomic sequencing, can take a lot longer, but is sometimes more accurate. And then there's also other types like FISH testing that, generally takes a little bit shorter of a time period. So for us, it took about a week to get the results in that showed that the tumor did present with the NTRK fusion. As a parent, you have a lot going on in your mind during that waiting period because there's so many different pathways this can play out. And it wasn't until we, got the diagnosis that though it was disappointing and sad to hear that it was cancer, we were in a way fortunate enough that it had tested positive for this NTRK fusion. We knew that there was a targeted therapy that we could try out and, hopefully would work out well for us. Support for families is so critical during this time, especially during the early days when there's so much unknown and you're just adjusting to this new reality. For us, we found a lot of support through definitely our medical team, but also beyond that, into different patient and parent organizations that specifically related to either this specific diagnosis, or we found a group called the NTRKers that was for people who have cancer that has this specific NTRK fusion. We also found groups for parents who had children with cancer, as well as the specific cancer itself. And all of these avenues helped us connect with people who could relate a little bit more to what we were going through. And ultimately, it just makes you feel a little less alone, because going through something like this, it's likely something none of your family and friends have experienced. So finding people that you can connect with really helps it feel a lot less isolating. Navigating a pediatric cancer diagnosis is incredibly difficult. I would definitely advise anyone, if they are in a situation like this, to talk with your medical team about NTRK testing. Make sure that it's something that they are considering. And two, I would tell any new parent who's facing this that there's nothing you could have done to cause this. This isn't your fault. And most importantly, I would say try to find support. So making sure that you arm yourself with knowledge, whether it's through just learning as much as you can about the specific diagnosis, connecting with other families or people you may know who have shared experiences, and of course, talking with your medical team if you have any questions. It's really important that you feel empowered in this journey and you take an active role, because not only does your child need it, but it's the best way to kind of get the best outcomes for you and your child. And don't neglect your own mental and emotional health in this as well. Make sure that you can be strong for your child as you navigate this together.